This video will teach you how to inject your SOLIQUA pen correctly using 6 easy-to-follow steps. SOLIQUA is available in 2 different pre-filled pens with 2 different dosages. You can tell the pens apart by their different colors. The peach pen is the 10 to 40 dose, while the olive pen is the 30 to 60 dose. Be sure to check that you have the correct pen according to your prescription. Before using your SOLIQUA pen, speak to your doctor, pharmacist or nurse about how to use this treatment. You should also read the instructions for use leaflet, which can be found in the SOLIQUA packaging for additional information about how to use your pen. The SOLIQUA 10 to 40 pen contains 2 medicines, a basal insulin called insulin glargine 100 units per milliliter and a glucagon-like peptide 1 receptor agonist called lixisenatide. This combination in a single pen is for a daily injection of 10 to 40 dose steps of SOLIQUA. 1 dose step corresponds to 1 unit of insulin glargine U100, and with each dose step of insulin comes the appropriate dose of lixisenatide. When you're ready to use a new pen, remember to take it out of the refrigerator at least 1 hour before your injection to let the medicine warm up. Step 1. Check your pen. First, check your pen and the expiration date on the label to make sure the pen has not expired and that you have the correct medication. Do not use the pen if the medication looks cloudy, colored or contains particles. Step 2. Attach a needle. Next, attach a new needle. Always use a new sterile needle for each injection. That helps prevent needles from becoming clogged or contaminated. Remember to always use needles that are compatible with a SOLIQUA SolarStar pen. Never reuse a needle. To open, peel off the protective seal, then keep the needle straight as you screw the needle on. Pull off the outer needle cap and put it aside for later. Then you can pull off the inner needle cap and throw it away. Step 3. Do a safety test. Before each injection, it is essential to do a safety test. This helps to make sure the needle is working properly and that you get the correct dose. Set the pen to 2 dose steps. You can select 2 dose steps by turning the dose selector until the dose pointer is at the 2 mark. Press the injection button all the way in. Your pen is working correctly when medicine comes out of the needle tip and the dose selector resets to 0. If no liquid appears, you may need to repeat this step up to 3 times before seeing medicine. If no medicine comes out after the 3rd try, the needle might be blocked. If that happens, you will have to change the needle and repeat the safety test. Do not use your pen if medicine still does not come out of the needle tip. If that continues, use a new pen. Do not use a syringe to remove medicine from your pen. You might see air bubbles in the medication. This is normal. The bubbles will not harm you. Step 4. Select the dose. Once you have completed your safety test, you can select your dose. Make sure a needle is attached and the dose is set to 0. Turn the dose selector until the dose pointer lines up with your dose. If you turn past your dose, you can turn back down to your correct dose. If there are not enough units left in your pen for your dose, the dose selector will stop at the number of units left. If you cannot select your full prescribed dose, split the dose into 2 injections, or use a new pen. Only in this case is it okay to inject a partial dose of less than 10 units. Otherwise, do not use this pen if you need a single daily dose that is less than 10 units or more than 40 units, which are shown as white numbers on a black background. When you have selected your dose, it is time to inject. SOLIQUA 10 to 40 pen can be injected in the thigh, belly or upper arm area. Change the place within the area you inject each day. This will reduce the risk of developing dents or lumps at the site. Step 5. Inject the dose. Push the needle into your skin and then place your thumb on the injection button. Press the button all the way in and hold. Remember, do not press at an angle. Keep the injection button held in, and when you see 0 in the dose window, slowly count to 10. This ensures you get your full dose. After holding and slowly counting to 10, release the injection button and remove the needle from your skin. If you find it hard to press the injection button in, change the needle by following step 6, then perform steps 2 and 3 again. If you still find it hard to press the button in, use a new pen. Do not use a syringe to remove medicine from your pen. Step 6. Remove the needle. When you have finished injecting your dose, remove the needle from the pen after putting the outer needle cap back on. Keep the needle straight and guide it onto the outer needle cap, then push it firmly on. grip and squeeze the widest part of the outer needle cap. Turn your pen several times with your other hand to remove the needle. Throw away the used needle in a puncture-resistant container. Remember to put your pen cap back on before putting away your SOLIQUA pen. Once it has been used, store your pen at room temperature below 30 degrees Celsius. Do not put the pen back in the refrigerator once it has been used. Only new pens should be kept in the refrigerator between 2 and 8 degrees Celsius. Do not freeze. Do not store your pen with the needle attached. Store pen away from direct heat or direct light. The pen cap must be put back on the pen after each injection to protect it from light. And only use your pen for up to 14 days after its first use. This completes the steps to injecting your pre-filled SOLIQUA SOLAR pen. Always remember never to share your pen. It is for you only. Never use the pen if it is damaged or if you're not sure that it is working properly. Always carry a spare pen and spare needles in case the pen is lost or damaged. For further information on how to use your SOLIQUA SOLAR pen, check the Instructions for Use leaflet, available in the packaging, or speak to your doctor, nurse or pharmacist.